Sanibonani molweni bantu bakuthi kwindawo zonke nje enibukeleni kuzo Ebuhlanti namhlanje sinelunye undwendwe i-visitor a very important from Inarela international network of religious leaders who are living and personally affected by HIV. Here we call him Bobo. Bobo, how are you?
I'm
can
okay.
you greet our people out there and tell them who you are?
I greet all you viewers, and I'm happy to be with you here.
Yes.
Yes.
So tell us more about Inarela. I remember it used to be an Africa network of religious leaders. Now it's Inarela. Can you tell us more about this organization?
All right. So Inarela is an international network of religious living with HIV or affected by HIV. So Inarela was founded in 2002. Then it was formally registered as a civil organization in 2004 in South Africa. Then they transitioned from the name Anerela because it started as Anerela. So they transitioned from Anerela to Inarela now to accommodate the international aspect. So the international aspect was the main focus was inclusivity in terms of also other regions.
For instance, the likes of the late Archbishop Desmond Tutu is one of the co-founders.
Exactly.
Of this organization.
Yes. Then it became international, the international network of religious leaders affected by HIV. From moving from the African context only. So that's how then it started. It is a member-based organization. It works in an interfaith network, but it's member-based, which it has got almost about 45,000 members in terms of membership. So when I say interfaith, I mean it's inclusive of any religion that exists. So it's not discriminatory in terms of who participates in this organization. So that's how Inarela is formed. We are in 16 African countries and also in 5 other regions, which is Canada. You have Asia Pacific. You have Central Asia,
including Madagascar. I saw on your website.
Yes, you also have America in there. We are but in Africa we are in 16 African countries. Country networks, we call them country networks.
Tell me why this organization? Because it's really interesting. Even the name itself, network of religious leaders who are living and affected by HIV. Who is qualified to be a member of this organization?
Okay, so it is made up of members. Our country networks are run by religious leaders in most cases who are affected or living with HIV.
Do you have some of them infected with HIV?
Yes, we do.
Okay.
We do.
They talk about it openly.
They talk about it openly. So the core and the focus of this organization was to give a platform, also from a religious point of view, for religious leaders to speak out about this, about HIV. And then because religious leaders have got so much influence in the communities, and the moment that they speak out about that, it is the chances of the community following and doing the same is very high. So that's the formation, the core aspect of it, to fight this stigma and discrimination in the community through those who are already testifying about it, and through religious leaders as our champions in communities. So the organization is there to capacitate religious leaders as change agents in our communities to be able to speak out about HIV.
Yeah. So what are the programs?
Yeah, so besides HIV, we do have advocacy where we, our religious leaders also advocate for the rights of children. Let me say general human rights.
Yeah.
Because it's not only children, but also in terms of women, the disadvantaged.
Yeah.
So yeah, we have advocacy. We also have ASRHR, adolescent sexual and reproductive health and rights. So this is mainly focusing on the access to services. It's a comprehensive health.
Yeah.
It's inclusive.
Yeah.
So if you go to a hospital, we expect you to receive, whether you are HIV or not, we expect you to receive services just like any other person.
Yeah.
So we fight that stigma where now those who are suffering from HIV or those who are infected by HIV are discriminated in terms of...
I mean, these days, even if you are from the LGBTI community, or you are a sex worker, when you go to health facilities, for instance, they'll cross-question you, interrogate you, where you also feel good, you know what, I'm not supposed to be here. So inarela iyakwazi ukungena in those areas to say, wait a minute, clinic is not a religious institution. People must access services.
Yes. So besides training religious leaders, so INERELA also is inclusive in terms of duty bearers. In terms of officials, like you talk of nurses.
Yeah.
Yeah, we do have nurses who are champions to fight stigma in health centers. So we also have even the police. These duty bearers who are fighting even violations of rights of...
Before we go, Sumhlambe Siyo told us something to drink. I just want to check because most organizations were affected by COVID-19. Some were even shutting down. Some are still struggling to recover. So when Sibuya from e-break, I want us to discuss that. INERELA imanage kanjani to maneuver from the COVID-19 because some people are now operating mobile. Our offices are no longer there. But must be a break-in. I want us to discuss that. Ikamalamke ndingumbulelo jasi nisesebhlanti sisakhuluma nje ne INERELA eyaziwayo ke globally. Stay tuned. Hayi ke sisesebhlanti sisahleli no Dr. Bobo here. So how did you manage to survive COVID?
Yes. So sustainability strategy. INERELA is community-based. We work with communities. So through our religious leaders, our religious champions. So yes, we work with partners also in terms of the finance part, but in terms of programs and the operations of the organization, because we have communities as our backbone. We survived through and continued with.
And you still have offices.
Yes, we still have offices. So the same congregants that we were serving before COVID, because we serve through our congregants, we serve through communities, through our traditional leaders. So these same people that were there before the COVID were still there after COVID, and we continued to do. So that's our survival strategy. Making sure there is a buyout of the programs or activities that we do towards fighting human rights, fighting gender-based violence, fighting inequality in terms of access to services. We use our champions, community champions, religious champions, so they existed even after COVID.
I mean, at some point I remember Ebuhlanti, if Nisakumbula, lapha emakhaya sike salapha eSoweto sihamba neSanarela. What's the relationship between the two institutions? I mean, I remember we were discussing issues of sex work, especially rights of sex workers in different communities. What is the relationship between these institutions?
Okay, so Inerela as an organization is Inerela. It has got a secretariat,
Okay.
which is based in South Africa.
Okay.
It is registered in South Africa, but it has got country networks.
Okay.
When I say country networks, I mean they exist in each and every country, which is 16 African countries, including South Africa.
Yeah.
So we do name country networks using the abbreviations that are on the main name.
Yeah.
So if it is South Africa, it's Sanerela, picking the Nerela from the secretariat. Yeah. And the first abbreviation is obviously for the country. So Sanerela is a chapter, is a country network which is now registered as a movement.
Okay.
Civil it's in South Africa, and these are it is led by a religious leader. Yeah, it is led by a religious leader, and they do this is our front.
Yeah.
Us as a secretariat, we have an oversight.
Okay.
Oversight management or oversight administration over those country networks.
Yeah.
But each and every country network is run by a country coordinator.
Yeah.
So
what are the challenges or success stories of these country networks? Do you have similar networks, for instance, in Ghana, Malawi,
Yes.
And so on?
Yes, we do.
Yeah.
We do have, and we have achieved this so much, and so far,
Yeah.
we all our programs, we achieve them through our country networks.
Okay.
There are a number of projects that are run by these country networks,
Yeah.
depending with the support that we are getting.
Yeah.
In South Africa, we do have Save the Children as a partner,
Yes.
which is supporting in terms of child rights.
Okay.
We also have Hands Off, which is fighting for the rights of sex
So
workers.
with this Save the Children, what is it that you are advocating? Yeah.
It's the rights of sex workers. I mean, the rights of children.
Yeah.
And besides that, we do have SRHR,
Yeah.
sexual reproductive health, and the rights or the equality or the access of services by children
Yeah.
in the health centers,
Yeah.
especially the most disadvantaged
Yeah.
ones. We also have life skills.
Yeah.
In the same context of child rights.
Yeah.
When we say life skills, we are trying to equip the children on how they can survive.
Yeah.
Yeah.
How is the response from parents? Because especially not only parents, including religious institutions, because immediately you mention rights of children, especially around comprehensive sex and sexuality. It's a problem. The whole notion is like these religious leaders are introducing sex to our children. How do you manage those dynamics?
Yeah, so the program or the focus is not to encourage sex.
Yeah.
It is to make sure that our children understand as they grow their rights in
Yeah.
terms of sex. You
Yeah.
know, it's actually protecting them from being abused.
Okay. Okay.
The girl child must know when a man touches them in a compromised way.
Yes.
They must understand that this is now abuse.
Yeah.
I must be able to report.
Okay.
So this is it's an education of. So when the word sex there is not the act.
Yeah.
It's-
Don't you think one day, maybe in partnership with Save the Children, maybe don't you think one day we need to have a meeting with the members of parliament, especially ACTP,
Yes.
because they disagree
Yes.
with this policy.
Yeah. So I think it will be very beneficial to meet the policymakers and explain the words there. I think it is taken in the wrong context.
Yeah.
It is not teaching children how to they act. No, it is teaching them to grow responsibly.
Yeah.
In understanding themselves that at this age I'm now having this kind of feelings and I have to manage
so
it
that
this way.
even before the magistrate or high court, a child must be able to say and express to say, this is what happened to me.
Yes.
This man touched me here. Children must be able to express themselves.
Exactly. They must know their body as well.
Okay, Bobo, makasiphinde siyothola amanzi siphinde sibuye ngathi iyashisa lento. I hope one day ubaba Musha from ACDP angasinika audience to explain this thing. Stay tuned. Ayeke sesesebhlanti ingxaki ibe lixesha amaxesha amaninzi kule nkqubo yethu imnandi injalo. Bobo, we were still talking about issues affecting children, and I hope that one day it's a promise that maybe we can meet lawmakers. We tried before in partnership with the Department of Education, but I think we need to have that conversation with members of parliament, in particular ACDP, ATM, and other interested parties in parliament. But what else are you addressing around issues of children, except the issue of sex?
Yes. Yeah. Okay. So I wanted to go back a bit to one of your questions where you were talking about the involvement of parents.
Yeah.
This is the most important aspect that we are bringing into the program or into the activity, where we want to bring the parents so that they can understand what their children are being taught.
Yeah.
You know, they should be a buyout of parents, and so that they won't be like surprised when their children are behaving in some way. We are not taking their position as parents in terms of their kids, but it's a supplement. Yes, it's a supplement as we come with comprehensive health. We are assisting, like we are assisting to make sure our kids are safe. And are living in safe environments. So we want to involve parents as well. Yeah. So besides sexual health, reproductive health and rights, we also, I was talking about life skills. Yeah. I know very well in schools they do have subjects and around there. Yes. But we then also go beyond that to bring experts. Yeah. I know besides the teachers that they have in schools, we bring experts who brings the practical aspect of survival. Yeah. In terms of life skills, practical aspects of survival. The reason why we bring this one is now it's a bit different. Should I say there's a gap between what we do and the one that they are taught at school? Reason why? We are taking a disadvantaged child who has been exposed to abuse. In some cases, maybe coming from a home that is experiencing gender-based violence, or they have lost parents or their parents, or because of economic reasons. It can be even migration. Yeah, so how does a child survive in such an environment? That may not be taught in schools, and but we are not saying the curricula is not, but they may not cover everything. Yeah.
So now that you work with country networks, how is the response of different governments? Because we know, for instance, that some governments are not comfortable with this subject, especially if you mention comprehensive. They think of LGBTI education in schools. There's too much misinterpretation in the process. Hence, I'm asking, how is the response of governments, especially through the country networks?
Yeah, so let me say this is an ongoing process.
Yeah.
It's an ongoing effort, which is not, we haven't reached the position where we could say we have done it all. No.
Yeah.
So we are exposed, or we have access to platforms, multilateral platforms like SADC and AU through our mother bodies. Okay, so in Southern Africa we have Child Rights Network of Southern Africa.
Yeah.
In East Africa we have Eastern Africa Child Rights Network.
Yeah.
These are our interface between us, implementers, and the multilateral platforms or multilateral bodies.
Yeah.
We try by all means to make sure the children are ahead. They are involved in decision making at SADC level.
Yeah.
They are involved in decision level at AU level. Right. So we go through these bodies that we may not as implementers go straight away, but we make sure we have child champions.
Yeah. Before I let you go,
yes.
Who is funding your country networks, and what are the challenges in those networks?
Yeah, we do have several funders, and we also get calls from different funding partners.
Yeah.
For gender-based violence, we had UN Women. We also have Save the Children. We have Hands Off, AIDS Funds, sorry.
Yeah.
AIDS Funds. So the several partners that are assisting us in the efforts, and they are helping us a lot to make sure.
Yeah.
So these are the funding that we then disperse as a secretariat, disperse to country networks to implement the activities that I was trying to explain to you.
Yeah. So with the country networks now are able to engage governments and stakeholders at that level. But is this enough? I mean, to distribute funds to such a number of countries? Is this sustainable?
Okay, it is sustainable in the sense that our country networks are semi-autonomous.
Okay.
Meaning to say they receive that portion from the secretariat,
Yes.
but they are free.
All of them?
All of them.
Okay.
All of them. They are independent to apply for
for
other
funds.
yeah, for funds nationally in their countries or from their governments, or even from other partners who are ready to assist them.
Bobo, before I let you go, any message to men of this country who continue to abuse children? Some, even parents, they don't understand why this whole thing of children, it's a big deal, you know.
Yeah, as men, I would want to say we need to change our mindset. We need to, if we want to achieve a community that is respectable, that grows respectably, we need to change as men. Positive masculinity, we have to practice that from the household level.
Yeah.
Positive masculinity towards those who have partners in the homes and even in our communities. We have to change the mindset. I think if we do that, we work together and we will achieve a community that is appreciable.
Bobo, thanks so much. We'll invite you again so that we unpack all your programs. Igama lami ke ndingumbololo Jasi mangithi nje lapha emakhaya ngcinzeleli